right, good morning, everyone. I'm Hartford HealthCare's Tina Verona. Thank you so much for joining us for our media briefing today. Happy Snowy Friday to all of you. We have a lot of folks on the line here, so good to see that. We've assembled once again our clinical experts, beginning with Dr. Ajay Kumar, our Chief Clinical Officer. We also have with us Dr. Jim Carden, our Chief Clinical Integration Officer, as well as Dr. Ulysses Wu, our Chief of Infectious Diseases at Hartford HealthCare. So thank you all for joining us. Our Chief Epidemiologist, I want to mention as well. So we have a lot to talk about today. Dr. Kumar will open it up and give us the latest on data surrounding Hartford HealthCare. And then we're going to turn it over to Dr. Carden. He will be talking about the expansion of our testing trailers to meet the increased community demand. St. Vincent's testing trailer is launching today, despite the snowy weather, because there is such a need for testing. So he'll talk about that, and plus plans to launch other testing trailers around the system. But first, I want to let Dr. Kumar kick things off with an update across the system.
Thank you. And good morning, everybody. I hope everybody's safe today, given the weather. So just to go over the numbers in Hartford HealthCare, we have 485 patients we are caring for right now who have admitted with the diagnosis of COVID, along with other things as well. Out of them, 65 are in ICU today. And as I remind you, as I've done that before, not all patients in the hospital have come because of the COVID. Majority have, but some of them have come here because they've got some other issues going on and they've been cared for, and they happen to have COVID as well. But it does impact our hospitals and our colleagues significantly, given the implications on PPE and safety precautions and everything else. In Bacchus Hospital, we have 49 patients. Charlotte Hungerford has 34 patients. Hartford Hospital has 185 patients. Just to give you a data point, back in the first surge, back in April 2020, Hartford Hospital had 211 patients with COVID, and today we have 185 patients. Midstate Medical Center has 44 patients. North Shore Hospital has 7 patients. St. Vincent Medical Center has 78 patients. Hospital Center Connecticut has 72 patients, and Wyndham Hospital has 16 patients today. We do have a fair amount of patients who are managed through our community network in our home care setting as well. Dr. Wu probably will outline later on, we have seen the increased number of Omicron in the state of Connecticut compared to 3 or 4 days ago. So the numbers are still rising. And as we had a debate yesterday regarding when the peak might be, and I think one of the way to track, at least the way I look at the number of cases being reported on the Omicron side, which gives us some glimpse of when it might come about as well. With that, I'm going to pass back to Tina, because the most exciting thing is to talk about the Fairfield region and the work Dr. Carden is doing in terms of testing.
Exactly. Dr. Carden, take it away. We have a very exciting day with the opening of the trailer in Fairfield County.
Yeah, thank you, Tina, and thanks everybody for joining you. We're excited to finally get this rolling. As everybody's aware, testing has become essential and limited, and we're excited to be able to start opening up these additional sites. Just to summarize overall, in the next week or so, we'll have 7 total sites in which we can do testing for the communities. The 2 that are existing now, Newington and New Britain, are open. We have started testing at a new site in Torrington yesterday, and St. Vincent's Medical Center goes on today. And then through next week, we will have 2 additional sites, an additional site in Norwich, 1 at Wyndham, and then lastly at Midstate. So at the end of the day, we'll have 7 different trailer sites open to increase our capacity for testing. Give you some idea of the amount of tests we're doing currently. We're doing somewhere around 30,000 tests a week, 4,000 a day. This will increase our capacity another 1,000 a day as we go forward. So we'll be increasing our capacity by additional 25% as this starts. These will be open when we get them all up and running. There's always a little bit of a shakedown period as we start, so a little patience would be great, but they will be open 7 days a week going forward. And we will continue to assess, see what the need is, and pivot as we get after we get this initial set up and running. Tests are by appointment. That is intentional to decrease the queuing up and the what we saw last year, where we had just a tremendous amount of people kind of lined up and waiting in line. We're trying to avoid that, and we will continue to look. Do we need to expand hours? Do we need to expand additional sites as we see what this looks like over the next couple of weeks? I'll stop there. For the moment, Tina, do you want to hold questions or let them happen through? It's up to you.
Sure. Yeah. Thanks, Dr. Cardin. Appreciate the update on that. Very exciting day. Before we get to reported questions, I want to give Dr. Wu a chance to make his opening remarks. Anything new to update since we met yesterday?
No, I think Dr. Cardin, Dr. Kumar succinctly and greatly summarized everything that is going on right now. We are certainly still seeing, just from an epidemiology, not just at HHC, but in the state, we are seeing a rise in cases, as well as hospitalizations, as well as ICU and ventilator utilization. We still hope that our prediction of middle of January, when all this will start
Connecticut Department of Transportation,
true. And so, and as Dr. Kumar alluded to before, we are starting to see, well, I shouldn't say starting, but we are seeing an increasing amount of Omicron.
How do things look for your crews out there?
Delta, as opposed to Delta. But we are still seeing Delta being isolated as of the period ending January 6th. It was actually split about even, the amount of Delta and Omicron that was still being sequenced in the state. So I'll stop there.
All right, thanks for the update, Dr. Wu. We're going to open it up now to reported questions that we're receiving in the chat, and we will take them in the order they are received. Our first one comes from Jordan Fenster from Hearst, Connecticut Media. Can you please talk about the availability of monoclonal antibodies that are effective against Omicron?
Yes, and so there are currently 3 monoclonal antibodies that we utilize against COVID-19. 2 of them are, for the most part, ineffective against Omicron. And so there is still 1 remaining monoclonal that we utilize against Omicron. Now, the natural question is, how do you determine whether or not a particular patient is experiencing disease from Omicron or Delta? Well, we're unable to discern that in real time, but what we do is that we risk stratify. And so what do I mean by that? We reserve the medication that works against Omicron for those that may be the most sick or maybe at most risk for developing complications. And the other ones are available, and we do reserve those for those who may not be at risk for complications associated, as much risk as they would the previous group. And so that is how we determine the allocation at this point.
All right, thank you. Our next question comes from Tracy O'Shaughnessy, the Waterbury Republican American. Dr. Kumar, we'll have you just mention the number of patients at Charlotte again. You also mentioned that the upside of the Omicron mutation is that it's resulted in fewer people in the ICU, but you still have a surge of people hospitalized. Is that because of the time it takes to treat COVID patients? Have you noticed that the amount of time the COVID patients are in the hospital being treated has changed with Omicron?
Tina, what I would like to do at this time is that have Dr. Cardin talk about testing, and we'll come back to Tracy and other questions later on. I think it's really important to highlight that with the capacity we are creating and what it means for the community at this time. So there are several questions which are related to testing. I think that should be discussed because there's a lot of demand for that. And we'll go through the details with Tracy either in this conference or later on. Would you mind jumping on to Dave's question?
Sure.
Thank you.
Yes, we'll go on to Dave Altamari from the CT Mirror. Do you have a breakdown of how many infections are incidental cases versus COVID cases?
David, it's about 20 to 30%. Actually, we are seeing incidental depending on different region. Obviously, every day is a different day, but that's approximately the number we are seeing is close to 30% is incidental findings.
A follow-up question from Dave from the CT Mirror. Also, Dr. Cardin, how many tests per day are being done at these trailer sites like St. Vincent's?
Yeah, right now, Dave, good question. About 130, 150 a day, something along those lines in a regular scheduled sort of appointments. And again, we'll we'll continue to adjust that as we go forward, but that's the current anticipated volume that we see.
Mary Catherine from Hearst Connecticut Media, has the state requested that Hartford HealthCare increase its testing capacity? If so, have they provided any support for new testing sites, financial or otherwise?
We've been in close contact with the state, but and obviously they'd love, everybody realizes people stepping up and trying to do more testing is a request. No financial support or otherwise, just whatever we can do to continue to expand, they would greatly appreciate it.
Nicole Leonard from WNPR Radio, regarding the new testing trailers, will these be by appointment only, walk-ups, or both? And what kind of testing will take place there? Nasal swab, saliva, antigen, molecular?
By appointment, and they are all nasal swab, self-swab, observed self-swab, PCR tests.
Question from Tracy regarding testing. Do you notice that those coming from testing have already used a rapid test and are trying to confirm? Are most of them symptomatic or just worried?
We don't necessarily inquire about those questions. We do, these tests are, these sites are available for both symptomatic and asymptomatic. There is more limitation to symptomatic testing. Many of the labs will test you asymptomatic if you've got an exposure or that you're traveling. So we do tend to see more likely people that are both symptomatic and positive as our testing trailers, which is why I think our incidence, when we look across our platform, our positivity rate tends to run quite a bit higher than the state average that is being reported.
Question from Dave again. Did you fill your slots today at St. Vincent's?
I believe they are. Now, we started with limited hours because of both the snow and the staffing, so we only started, I think, at around noontime. So today was going to be a little tight, and then we'll see if that levels out as we go forward. But not surprising, until we get these all up, I do expect there will still continue to be quite a bit of demand for the slots.
Question from Eliza Fawcett at the Hartford Current. Dr. Wu, could you talk more about the ventilator usage that you mentioned? Is that primarily made up of unvaccinated patients?
Yeah, it is. I mean, if you look at our ventilator utilization like a pie, the majority of that pie is all unvaccinated. There is a small percentage that are vaccinated but not boosted, but they have comorbidities at this point. So, but yes, most of them are unvaccinated.
Okay, and Patty and Rob from the Associated Press, Dr. Cardin, has the weather affected testing availability today?
Nope, all sites open and running.
That's good to hear. Eliza from the Current, being redeploying some staff to clinical roles, are there other ways in which Hartford HealthCare is filling staff shortages using traveling nurses, for instance? Dr. Kumar, do you want to take that?
Yeah, Tina, I can take a couple of questions actually in this regard, if that's okay. I just want to elaborate on the ventilator use. Hartford HealthCare is utilizing only 44% of the ventilations in ICUs right now. Is for the COVID patients. So we have a fair amount of capacity. I just want to make sure the folks know about the ventilator use. We have, in the first phase, we had expended a fair amount of capacity, and we continue to be well positioned for that without affecting any care for any patients at this time. Now, regarding redeploying some of the staff, one of the proudest thing about the Hartford HealthCare, which I find, is that the teams help out each other. We work as an integrated healthcare system. We make sure the teams are reaching out to each other in whatever the fashion, wherever the needs are, they of greatest needs, and lend a hand. We do, given the staffing challenges, not just our system, but entire state and our entire country is experiencing right now, especially the healthcare worker. We have relied on traveling nurses and other members. But I think there's a lot of good things happening in recruitment side of Hartford HealthCare, which we will be discussing in near future as well.
Okay, we do have a question regarding testing location in Torrington, but Dr. Cardin, can you talk about all of the testing locations where we're going to be having these testing trailers?
Sure. So in terms of the addition, right now, Torrington, we are using Crow Park as a testing site. That will be converted over to a trailer. So it will just be a transition, just because we're a little bit behind in terms of having the connectivity power we need for that trailer. So where we're going to have sites at the end of this, and these will all be on our the usual place you can find our testing sites, which is Hartford HealthCare COVID testing. We'll be in Newington, New Britain, St. Vincent's, Torrington, Norwich, Wyndham, and Midstate. as the first sort of go around. Our ability to expand with additional capacity at all those sites will depend on how we see this filling out and the continued need for testing as we go forward. So we have some further additional ability to expand after we get these stood up.
And Dr. Carding, if you will, for the media, could you elaborate given the staffing issues, how are we making this testing possible with our trailers?
Yeah, thank you for that. Actually, I should have highlighted that. The one advantage to the trailers as to what we did through with the large tent drive-throughs is the number of staff and the ability to manage the site is much easier. So that, as you recall, we had major challenges with trying to deal with weather, trying to deal with cold, trying to deal with sort of managing the drive-throughs. With the trailer, people are indoors, and it is relatively straightforward for limiting the amount of staff we need for people to come through. They'll be registered, they pick up their swab, they're observed to self-swab, they drop it off and they move on. So that as we look at that, it allows us to really streamline the amount of staff we need to do this and to not have to put ourselves in situations to where the weather gets really disruptive for us.
We do have a question from someone watching us on Facebook. Edie asks, will Hartford HealthCare spouses be eligible for testing?
So it may need a clarification. Everybody is eligible for testing if it's so required. So we do have, and I will highlight this, we do have a unique self-service for our colleagues who require testing, and that was streamlined to really simplify. Because that requires a way for us to do that, and it allows us some flexibility. It is contained to just if you're an employee. We can't quite extend it, and it's merely a functionality kind of process because we need you as an employee to be able to really do this entire self-service that we've set up for our colleagues to make this really easy for them to test as it goes forward. But testing is available for both employees and our colleagues who are actually employed, as well as their families, just not through that same process.
Question from Mary Catherine. Could you discuss flu shot uptake? Has the uptake been lower than in previous years? And if so, why might that be? Dr. Wu, I'm going to send it over to you, and I have a feeling masks might be involved in that answer.
Yeah, that's actually a good question. I don't know what our state flu shot uptake has been. Obviously, we are mandating it here within our health institution. So I can't tell you that it is lower. If I had to guess why, if it is lower, I think people have looked at masking as an alternative, but I think people are fatigued. They're fatigued of not just COVID, and in the wake of COVID, we lose a lot of the other respiratory illnesses, such as influenza and some of the other ones. And so I think if people have said that they're not going to get a COVID vaccine, I can extrapolate that maybe somebody would not want to get the influenza vaccine as well. But on the other hand, people who are very avid about getting the COVID vaccine certainly have gone out and gotten their influenza vaccines as well. So I would actually expect the percentages to probably be around the same.
Follow-up question from Nicole about staffing on Dr. Cardin's comments. What about the size and the healthcare team staffing these new testing sites? What size of the healthcare teams do we have out there at these testing sites?
Yeah, you can run a trailer with essentially sort of 3 people overseeing it. So it's a relatively small team that's required in this because it's a lot of pre-registration coming through, getting the swab and moving. And then we have there's the team that's doing this, but also the small army behind, because the trailer and the swab is just the beginning of our process. It is the entire resulting and the care that we make sure that people are connected to, which is the back end, and managing people who are positive is a major focus of us. We're not doing testing just to give them a test result. We're also trying to make sure those people get connected to care, either through their existing physician relationships, or we're offering our ability for us to extend ourselves to make sure that people who may require adjuvant therapies or therapeutics in some way, shape, or form, or need additional assessment, that we've connected them in a timely way to get them the care they need. So the team that's doing the swabbing and the collecting of the results is just a small tip of the iceberg of the team behind that's really supporting this entire effort.
Dave from the CT Mirror, are you planning to change your policies for releasing patients to nursing homes after yesterday's guidance from the DPH? Will you give boosters to patients you are sending to these long-term care facilities?
I'll take that, Tina. We've always attempted for the appropriate patients to receive vaccines or boosters. And obviously our teams are looking into that, how it changes our approach. These are always on top of our mind for the safety of patients.
Yep, follow-up question from Dave. You might have missed this. Norwich and Wyndham testing sites supposed to open on Monday, Dr. Carter?
Wednesday, Dave.
Wednesday.
Tina, you want me to go back to Tracy's questions?
Yeah.
So booster mandate. We in Hartford HealthCare, we've been giving boosters. Our teams have been advised for a while for our colleagues to get the boosters. As you know, it's a rolling number. Every day changes given the eligibility time when people got the first or second dose. But I can safely tell you over 55% of our healthcare workers are already have received boosters. And numbers probably higher. I'm probably a little bit more conservative in that. But we are doing an assessment and obviously we'll support as needed. Tracy had asked several questions regarding the number of patients in Charlotte Hungerford. In Charlotte Hungerford, we have 34 patients. And you mentioned the upside of the Omicron mutation is that resulting in fewer people in ICU, but you still have a surge of people hospitalized. Tracy, I do struggle sometimes giving numbers to you because I don't know whether it goes in the right way. Let me explain one more time. As the number of total COVID patients in the hospital rises, we see proportionality of that ICU number rising as well. Not all patients in ICU who have COVID are because of COVID as well. Data point. Number two, we have seen in proportionality compared to the first part of the surge when we had more than 50% of the COVID patients in ICU with COVID, we are seeing less than 1/3 at the moment in ICU with COVID. I hope that helps you understand this data point here. The second question is that because of the time to treat the COVID patient? It's not so much about the time to treat the COVID patient. If you're unvaccinated and if you haven't got a booster, you're more than likely going to end up in ICU with COVID and have an ultimate higher mortality. So essentially, when we have patients who come with vaccinated status or boosters, they have shorter length of stay. They require less critical time or critical care time or no critical care time in the hospitalization. And generally milder disease will require some help. I hope that answers your questions around that. And you do have one about the mandate, which I already addressed.
I think we've addressed all of her questions, Dr. Kumar. Thank you for that. And going back to that, I don't see any additional questions in the chat. So at this time, we're going to just close it up with final thoughts. Dr. Wu, we'll start with you. Kind of takeaways.
Yeah, I mean, I think there is an ebb and flow to COVID. We are in unprecedented times in medicine where we try to be as proactive as possible, but there are times where we have to be reactive. And medicine at times can be a monolith that reacts very slowly. But I have been very impressed with what our state has done. And I'm not just going to promote HHC, but I'm also happy what HHC has done, how we've been able to pivot and respond in a way to a pandemic that we have never seen before. In the past, it would take a lot of time for things to change in medicine, but it is incredible the amount of work that people are putting out to respond to changes, to be able to pivot to the community's needs and really help them. Now, I know this sounds like a rah-rah cheerleading talk, but I'm impressed by the resilience of what everybody has done. And we are hopeful that the peak is approaching soon and that we'll be able to ride that slope down. But I think I'm highlighting this today because of Dr. Cardin's topic that with the testing, because I think it has been essential. There's been pushback with testing How accessible is it? Well, we're making it more accessible, and we stood that up very quickly. And so I'll leave it at.
And I think just to piggyback off of what Dr. Wu said to making testing more accessible, that's exactly what we're seeing today with opening the site in Fairfield County in a snowstorm. There is a real critical need for testing, and to be able to still launch as planned in a snowstorm, I think goes to attest to the teams that we need to address this, and we are addressing it. So Dr. Cardin, final thoughts about the testing trailers.
Yeah, thank you. And yeah, I'm impressed with the team that here at Hartford HealthCare being able to pivot and do this. You know, it's not, we just have to remember, not long ago, we had the Newington trailer and it wasn't even full. And I'm not even talking a month ago, people were not filling all the slots, and we suddenly find ourselves having to move very quickly. And it's a small army of people that got this done, and we will continue to push forward. It's essential that we play this role and we embrace it, and we just need to keep pushing forward to try and stay ahead of this thing.
Thanks, Dr. Cardin, and we'll end with Dr. Kumar.
Thank you, Tina. Dave, I want to go back to Dave Altamari's questions about the number of individuals who are here in the hospital with non-COVID related. Interestingly, when I was talking to you, I just got an email literally from one of the region in St. Vincent Medical Center. One of my team members did an analysis and said, email says that 34% of the total positive patients are not here for COVID related reason, 34%. That's a data analysis looking at every single chart at this time here. So, you know, most important thing to note that this surge is different than the first and the second surge. We have more tools, we have more knowledge, we have more wisdom about how to manage the disease. We are dealing with different type of virus, which is rising in the community at the moment. And we are dealing with most important thing, which we are concerned about, this fatigue among the staff and the wellness of the staff, which our team has done. You know, our team continues to do a wonderful job, and our wellness team and other support system in the Hartford HealthCare continues to pay attention to that. So as we go forward in this surge, the community needs to know that the Hartford HealthCare, the way it at least works, is in a well-oiled machinery or well-integrated system. We support each other out to make sure the access remain open for the community members. So if the reason I'm sharing this information with all of you, if you have underlying disease, if you're suffering from any ailments which you're trying to put this off for future, it's not a good idea, because we see and we saw after first surge increased demand for healthcare needs at the time. And similarly, we worry about that as well. So please don't put off your illnesses and disease. Pay attention to social distancing, the things we already know, and be aware that the hospitals like us and many other hospitals in the state of Connecticut and beyond have done a lot of work to make sure the community remains safe, and we are using the safe practices every single day. I hope that's helpful. Thank you, Tina.
Always good to reiterate those points. Thank you, Dr. Kumar, and thank you to Dr. Wu and Dr. Cardin for joining us today. And of course, to all of media, we will be back here on Monday, same time, but for now, enjoy your weekend and be well.
Thank you.
Thank you.